So have you ever had pain in this area of your thumb or your wrist? If so, try this trick. All right, I want you to hold your thumb and I want you to turn your wrist toward the pinky side, pulling on the base of your thumb. Does that increase your pain? If it does, you could be dealing with what's called the Quervain Tenosynovitis. And what that is an inflammation of the tendon sheath that runs around the tendon on the base of your thumb and the radial side of your wrist, which is the thumb side of your wrist. What if I told you that there's an easy taping application that you could try to put on that could potentially reduce the pain in your wrist? If you're interested, stick around. I'm going to show you how to do that today. Okay guys, so for this taping application we're going to need, of course, a pair of scissors to cut the tape, and you're going to need two pieces of tape, one longer, thinner piece, and then one shorter, wider piece. They do sell the 1-inch width tape, which is ideally what you would want for the longer piece, but if you don't have that available, you can take a 2-inch piece like this and cut it in half lengthwise to get your narrow piece of tape. And on the 2-inch piece, that's the shorter, wider piece, you're going to need to come into each end and make a snip and cut it directly in half, about 1 inch into the tape. As you can see here, I've made a little snip here and then came to the other end and made a little snip there, and we'll talk about why we need that a little bit later in the video. Okay guys, so let's get right to it. So your patient should be in about 90 degrees of elbow flexion or somewhere close to that. Have them forearm neutral and have them in just neutral as far as radial and ulnar deviation. Their thumb is at rest. You want to take your longer strip of tape, which is 1 inch wide. Again, you're going to tear the paper off one end to give an anchor point. You're going to anchor the first piece of tape just proximal to the nail, right at the nail bed area. You want to put that on, press it down, rub it in to activate that adhesive just to get it nice and anchored. And then you're going to bring the tape up. You're going to pull the rest of the paper off except for about the last inch or two, just to give yourself a handle to hold on to. Then you want to follow the tape back around towards the lateral aspect of the elbow, not all the way to the lateral epicondyle necessarily, but in that direction. Put a slight stretch, maybe a 50% stretch there, and anchor that. And then you can bring their wrist, they're in neutral, you can bring them up into radial deviation, and then that just gives you some slack in the tape, just a little bit, to be able to smooth it down. You want to make sure that's all rubbed in really well. Activate the adhesive, make sure it's anchored, nice and smooth, all the way up. Okay, so that's the first piece, nice and anchored. And at this point, when they come back into neutral, you can already see how this tape is starting to lift this area. And that's the idea behind this, is really to lift the tissues on the radial side of the wrist to relieve the pressure that is on that side of the wrist. Second piece of tape, you're going to come in and tear it right down the middle, and you're going to hold the paper, kind of peel the paper back, and hold each end. And on this one you want to put about a 75% stretch, so you want to put a pretty good bit of stretch, and the middle of the tape is going to sit right over where they say is most painful, which is typically about central aspect of the radial side of the wrist, right there, just right over the base of the thumb. And where they tell you that is, put about a 75% stretch, come over that and anchor that, and then that's sitting there, right? Okay, so the central portion is there, rubbing that in, and then you just peel the paper off and you stick down the last bit, those two tabs on each side, with no stretch. So the last two tabs get just pressed in. And the reason that we cut the little slits is just to allow them to flex and extend their wrist without this tape bunching up. That's why you have the slits. Alright, and there you have it, piece of tape number one, running from the base of the nail all the way back to the lateral aspect of the elbow. Piece of tape number two running around the radial aspect of the wrist. And a couple things this does. Number one, as I mentioned earlier, it just creates a little lift to the radial side of the wrist, and it also, this long piece of tape prevents the patient from going into too much ulnar deviation, because of course ulnar deviation tends to elicit more of that pain on the radial aspect.
Hey guys, thank you so much for taking time out of your day to watch this video. We hope you learned something today and that this was helpful to you in some way.
So our goal for this channel, The Upper Hand, is to give you guys the upper hand as you seek to better understand conditions of the upper extremity and just all topics related to occupational therapy in general.
So please take a second out of your day, make sure you like this video and subscribe to this channel so that you can be sure that you're going to see all of our upcoming videos. Thank you guys so much, and we'll see you next time.